Well, this is a little homemade informal video. We don't have any script, any plan, but that's how I like to do things. I'm in Soldotna, Alaska on the Kenai Peninsula at a Plaintree-oriented hospital, a Central Peninsula General Hospital. And today, during a presentation, I met Kathy East, who exemplifies the idea of a health coach that I've been talking about. And is this something that all Plaintree hospitals have, as far as you know?
It is. It's one of the elements of a Plaintree designation is that you have someone like myself who has access to health resources and helps patients use those resources.
So her job title is Knowledge Navigator. And I just love this because, as I'm always talking about, you know, if patients want to be engaged and learn about something, and they don't know what they're doing, what do? Do you smack them down? That's considered child abuse, right?
Right.
Or do you develop their abilities, help them get better at what they want to do? So Kathy, so she brought a folder with some examples of some things that she gives people. Why don't you explain?
Okay. Well, what I do is I round on patients that are in the hospital. I also work with patients in the outpatients clinics and so on, but I go in and talk to them and ask them if they would like more information about whatever their diagnosis or treatments or procedures they're having done. And a lot of times they've been given information, but a lot of it is something that either is kind of over their head or they're giving it to them as they come into the hospital. They're not feeling well, not understanding it. So I give them things to take home. And so, for instance, I'll prepare a packet just for information for them. One of the things I do is that I've got one for strokes where I give them some fact sheets, give them some information about online support groups. I've made up some what's called LibGuides or library guides where they have
you can talk. I'll be the Vanna White.
And on there I've put like websites that have support groups or different places that they can go to get information. And that sometimes just kind of depends on what it is. Give them diagrams. We also have a really cool thing. We have some iPads with a program that's called Explain that has some. Are you familiar with that? Oh, I should have brought one of those. But they basically what it is, it's a self-paced slideshow kind of thing that talks about stuff. So, for instance, a doctor tells a patient they have. Oh, that's great. That they have AFib, and the patient doesn't really quite understand what that means. So this is great. It has a little diagram of your heart and kind of shows you what that means and how it works. And you can go through it at your own rate, and you can either listen to it or just look at it and read it. And it's a great way to give patients education on a level that's understandable. And then that helps them too to be able to go to the doctor and say, okay, now that I know a little bit about it, these are my questions to have.
So this, what you've described so far sounds a lot like regular patient education that any hospital might have. Are you aware of any difference between what you do and patient education in general terms?
Well, yeah, because I think the difference is that I go around to the patients on an individual basis and just kind of see what they need individually. And if they need something like in another language, or if they need something on a different reading level, if they're, sometimes a relative will say, well, I need this for my mom or dad or whatever. I also get asked all kinds of bizarre questions when I tell them I'm the Knowledge Navigator. I have people ask me about getting good well water. Here in Alaska, we live in a rural area, information about how to test their well water. The strangest one I ever got was somebody wanted to know if you could bury a relative in the backyard, which I was kind of concerned about because I wasn't sure why they were asking, but but it was a legitimate question. So, we try and personalize it and make it exactly what that particular patient needs, rather than just saying, okay, here's a packet for everybody who has a stroke, you get this one. What I do is go through and talk to them and then figure out what things might be best. And if they want some help with navigating on the internet, I can kind of give them some pointers on where to start and how to get going with that and feel comfortable with it.
So this card, this laminated card, I loved. My eyes popped out of my head. So, an abundance of information is around us. Where do you start, right? We can provide personalized information packets. I can easily imagine for the family that is thinking, what do we do when we get home? What do we need to know? And on the back is a list of suggested websites. So this is encouraging patient engagement. The thing that I would love to see added is a list of recommended patient communities as well.
Yeah.
Things like Inspire.com, SmartPatients.com, the breast cancer social media community. So let me ask, as part of the Plaintree designation, were you taught any particular approach to this or any particular way to think about this issue philosophically?
Well, yeah, it's sort of because the Plaintree is focused on patient-centered care and on empowering the patients, much like you encourage people to do, and that give them the information so that then they can use that to help understand why they should take their medications or why they should do a certain regimen after a surgery or whatever. And so the more information they have, the more empowered they are to make informed decisions and to also understand why they need to comply with whatever their physician does. And a lot of people, it's interesting, a lot of people don't want to ask their physician questions even if they have so they will ask me about it, and then I can kind of be a go-between and say this patient needs some more information about this or that, and kind of help them on a level that is comfortable for them to do. So that's my my background in training. I'm in education, and I also have some experience doing medical research. I did drug trials at the University of Utah for many years, so I had patient and physician interaction, and I'm comfortable with going to the physicians and saying this patient needs more information, or to the patient and saying, well, this is what this means, or here's some something that's written so that you can understand it, or a picture or whatever diagram thing.
Do you ever get follow-up questions after people are discharged?
I do. That happens quite a bit, because a lot of times patients, when they're in the hospital, sometimes they're just kind of still kind of befuddled and not sure what to ask, or overwhelmed with everything. And so I always give them my contact information, and I do have a lot of patients then that follow up later. They'd either come in and visit and say, hey, I want to know more about this, or call and want some more information about things. So that's a very valuable tool too, because they're given so much stuff in the hospital, as you well know.
Sure.
You can't possibly digest it all. And so I tell them, well, go home, think about it. When you get to the point where you're ready to ask a question or find something, give me a call and let me know. And so that's a great tool for them to have as well.
Good. Well, thank you very much. This is ePatient Dave and Kathy East, the nurse navigator at Central Peninsula. Knowledge Navigator. Thank you. Knowledge Navigator at Central Peninsula General Hospital in Soldotna, Alaska, on the Kenai Peninsula. That's it for now.
All right.